Hello, everyone. Hi, I'm Sarah Martin. I'm one of the moderators of the GBV AOR Community of Practice, along with Beth Van. We'd like to thank you for joining us today during the 16 Days of Action Against GBV for this very interesting webinar. First, a few words. Next slide, please. About what is the GBV AOR Community of Practice, in case you're new to this and you aren't a member and you'd like to join. We're a community that offers a virtual space for ongoing field-centered learning for those working in gender-based violence and emergencies. We currently have over 900 specialists from all over the world in our group. We are a virtual platform for both learners and experienced specialists to discuss challenges and troubleshoot solutions for your work. We provide a place for our members to get support from their peers, to share new resources, to brainstorm solutions to common GBV program-related problems, like transitioning from an in-person GBV case management response to going online, or like managing issues like who to share data around GBV with. You can find a lot of these materials, both that we've created on the GBV AOR website and also on our GBV AOR YouTube channel. We bring together specialists to address key topics, like what we're doing today in this webinar. We highlight key resources like the interagency GBV minimum standards to make sure everyone in the community can benefit from our learning. The membership in the GBV AOR is for individuals working for GBV and emergencies. Anyone who works in GBV is welcome to join. It's not one person per organization. It's for you individually, not just for your organization. So if you want some more information about joining, just send us a message to gbvcop@gmail.com, and I'm also going to put that in the chat. Next slide, please. Another key service that we want to highlight that the GBV AOR offers is the help desk. So you can see more information about the help desk here on this slide. And I'll also put some information in the chat on how you can reach them as well. The help desk lets members get in touch with a gender-based violence specialist when they need additional support. You can see this information. You can read some of the evidence digests and guidance notes that they prepare. And you can also just go and talk to a gender-based violence specialist for free, who can give you a little more support that you might need. Okay, next slide, please. So just a little housekeeping here as we start. This webinar is going to be recorded, and we will share it with everyone who's registered. We'll also send you the PowerPoint slides and materials that are going to be referenced during the webinar as well. You can also find all of our community of practice webinars on the YouTube channel that the GBV AOR manages, and we'll share that link as well in the chat. Please stay to the end of the webinar because we'll have a very short evaluation poll that we'd like to get feedback from you just to help us improve our offerings. And if you have any thoughts or comments about our webinars or topics that you would like for us to present or anything at all, we'd be always happy to hear you again at our email address, gbvcop@gmail.com. Next slide, please. Okay, so without further ado, I'd like to present my good friend Sujata Tuladar, who I have known now for quite some time, through many different countries and many different roles. And it's always a pleasure to see you on screen and in person whenever that happens, which is rarely nowadays. But I'd like to present her, who's going to introduce you to the topic and introduce the other speakers. Sujata, over to you.
Thank you so much, Sarah. This is always a pleasure to share the screen with you and to have this opportunity to engage. Good morning, good afternoon, colleagues, and thank you so much for the opportunity to interact with the GBV AOR community of practice on some of the work that we at UNFPA Asia Pacific Regional Office have been doing over the last few years on strengthening disability inclusion in our gender-based violence programming. And in today's webinar, we hope to present a glimpse of what we've attempted over the last few years, what you've learned, and hopefully engage with the members of the COP in meaningfully taking this forward. We sit with a lot of lessons learned, and we would like to be discussed more widely, and hence this webinar today. So thank you again to the COP for giving us the space and this opportunity. If we can move to the next slide, I would like to quickly introduce the speakers for this webinar. So we have Emma Pierce, the gender and inclusion expert who's been engaged with UNFPA Asia Pacific Regional Office for the last several years. We have Dilshad Pari, GBV Program Analyst with UNFPA Pakistan. We also will hear from Jahidul Islam, National Disability Coordinator for UNFPA Bangladesh. And finally, as Sarah introduced, I'm Sujatha Thuladar. I'm the Gender-Based Violence Advisor for UNFPA Asia Pacific. Thank you so much. Next slide, please. As I mentioned earlier, today we hope to really present a few new tools and resources that we have developed for inclusion of women and girls with disabilities in GBV programming in a meaningful way. This has been developed through a piloting process, so we will also share some reflections from that. And we really truly want to have a discussion on the gaps and opportunities to systematically strengthen disability inclusion in GBV programming in various contexts. And so we're really looking forward to an active engagement in the second half of this webinar. Next slide, please. So just to give a bit of an overview and a background as to why we undertook this, for the longest time, this has been something that we've been wanting to do, but we wanted to really be informed by what is out there. Why has there not been a more meaningful, systematic, inclusion process for our GBV programming? So we did an initial mapping of the barriers for disability inclusion in our GBV program. It was a very internal exercise within UNFPA Country Offices in our region, where there's robust GBV programming ongoing. And the question was really to have an internal reflection on how we can meaningfully ensure disability inclusion. And this was a really enlightening experience for us because it really showed us that much of the hesitation or perhaps lack of, a lot of progress in with regards to disability inclusion in the GBV programming is not necessarily because of lack of commitment, but rather the fear of doing more harm and not knowing how to support women and girls with disabilities, how to meet their needs. And therefore, with the fear of doing more harm, a lot of programs were not attempting to do this at all, or where there were attempts, they were perhaps not meeting the needs where they needed to be. There was also quite a bit of confusion that disability inclusion means a separate, parallel, very targeted initiative, rather than ensuring that existing services are enabled and strengthened and supported to meet the needs of survivors with disability. So this parallel targeted initiative meant additional funds, which are hard to come by, and therefore a lot of these initiatives never took off. So this attempt that we've made in the past few years was to really sort of support those who are engaging and developing GBV program to be better equipped to understand the needs of women and girls with disabilities, the vulnerabilities, and also the entry points for meaningful inclusion, as well as ways to reflect back any feedback into the program structures and cycle. So we are continuously growing and and developing in the various contexts. Next slide, please. This initiative also came alongside, as UNFPA's global strategic focus on disability inclusion was increasing. Here you can see our UNFPA strategic plan 2022 to 25, which makes ending gender-based violence as a cornerstone, as a transformative result, but also really adopts a whole of institutional approach, that focuses on accelerating the implementation of the 4 pillars of the United Nations Disability Inclusion Strategy, which we can also link that to in the chat. So this global strategic focus on disability inclusion really helped us also kind of give momentum to this initiative. Some of the key aspects of our disability inclusion strategy, I wanted to highlight, is that it really adopts a twin track approach, with disability being systematically included in all UNFPA programs and activities, and disability specific initiatives also alongside to address situations and conditions of marginalization faced by persons with disabilities. And in terms of taking this forward, coordination, collaboration, and and partnership with civil society, particularly organizations of persons with disability, is mentioned as a critical central principle that's promoted across global programming. And finally, the strategy sets forth the key areas of concern for UNFPA programming as promoting the sexual reproductive health of rights and rights of women and youth with disabilities, including through, GBV programming and supporting persons with disabilities who are affected by emergencies. And as I mentioned earlier, as ending gender-based violence is one of our transformative results, this really gave that space for us to be fully committed in taking this forward and ensuring that all efforts to address gender-based violence are inclusive of and accessible to women and girls with disabilities. Next slide, please. Those of us who are joining the call today are probably very much aware of this. The global evidence indicates that persons with disabilities are more likely to experience violence, abuse, and exploitation than their non-disabled peers. And more, the evidence that's coming from Asia-Pacific region also demonstrates the same, that there are high rates of violence against women with disabilities compared to those without disabilities. And here you can see a few statistics that we are quoting through the Nova Data Initiative that UNFPA Asia Pacific Regional Office runs to support countries to collect prevalent data on violence against women. We're also now looking into the prevalence of violence experienced by women with disabilities, particularly focusing at intimate partner violence, and we'll be coming out with some research data on that very shortly. Next slide, please. And again, just, probably a point of repetition for many of us here, but just to kind of highlight that it's important to note that disability and violence are inextricably linked, with disability adding to the risk of violence, and while experience of violence may also cause increase in disability. Here we have some experience from Timor-Leste, where women who experience intimate partner violence have reported to be twice as likely to have a disability, including depression and other mental health conditions. Next slide, please. In the interest of time, I won't go into too much detail into this, but just to highlight a range of global tools on disability inclusion in the broader sexual reproductive health and rights programming that have been developed through We Decide program, which focuses on the rights of women and young people with disabilities. In particular, during COVID, there was a collaboration with UN Women and Women Enabled on a UN PRPD project exploring the intersection of gender and disability in the COVID pandemic, which resulted in a checklist used by country offices and partners, and it's mentioned here, and we'll also link it in the chat. Next slide, please. So here it's just a quick glimpse of the key tools that we'll be sharing with you today. The first one is a tip sheet on disability inclusion in GBV programming. And the purpose is to really help, figure out where to integrate disability inclusion within the cycles of GBV program planning. Specifically, it has 3 top actions for planning, implementation and monitoring. And we'll go into much more detail when we go further into the webinar. And the second tool is the disability inclusion assessment tool. Again, we'll go into more detail on this, but those who are familiar with the essential services package for women and girls subjected to violence will find that there are lots of similarities because we've really built it across, the principles of the essential services package. And we'll also be sharing a little bit about the documentation of some promising practices while we piloted this. So with that, let me turn to Emma for the next part of the webinar. Thank you very much. Oh, just a quick mention here of a microsite, which is where we upload all the resources, but we can quickly run to the next slide now. Thank you. Over to you, Emma.
Thanks so much, Sujata. Hi, everyone. My name is Emma Pierce, and I'm a gender and inclusion consultant. As Sujata mentioned, I've been working with the Asia Pacific office for quite some time now, but I have a long history of working on disability inclusion in GBV programming in the humanitarian sector. So it's great to make contact with you all again through the community of practice. What I'm going to be sharing with you today is a little bit more detail about those tools and resources that Sujata just mentioned very briefly. Next slide, please. So the first thing I wanted to let you know is that all of the tools and resources that we're going to be talking about today are available on the UNFPA APRO website. This is the link to the website. I've also put it into the chat box there. And the first tool that comes up is our Promising Practices document or publication. But you can see further down the website page that there are links to the tip sheet on disability inclusion in GBV programming and the GBV and disability inclusion assessment tool. Next slide, please. So what I'm going to start with today is sharing with you a bit more information about the tip sheet. Now, this tip sheet was something that we designed for UNFPA Country Office staff with the objective of helping them to integrate disability into GBV program planning. So whilst this did target UNFPA colleagues, we decided to publish it and put it online because we realised that a lot of you might be engaged in different types of GBV programming, designing, implementing, and then monitoring those programs. And so we hope that this tool will be also useful for you. The way it is structured is we give a select number of top actions, the absolute sort of top line activities that you might want to consider relating to disability inclusion in the planning, implementation, and monitoring phases of your programs. Next slide, please. And this is just a snapshot of what those top actions are. And you can see that we've really tried to keep it quite prioritized, quite concise. I'm going to just describe very briefly now each of these actions, but when you go to the tip sheet, you will find that there's a lot more detail about them and also links to other tools and resources. We were aware that there is actually quite a lot of tools and resources out there now on disability inclusion in GBV programming. And so we wanted this tip sheet to really help our colleagues to figure out where they can go to get more information depending on what they're working on in their GBV program. So first of all, under the planning phase, one of the things that we recommend, thank you. One of the things that we recommend is that you do a review of the legal and policy frameworks on disability and GBV. Oftentimes we'll look at the GBV frameworks, but we'll fail to look at the disability ones. And a lot of those can give us some can be very valuable tools for us in making our GBV services more inclusive and accessible. The second action that we recommend under planning is to establish partnerships with inclusive civil society organisations. Most of us on the call now will be very familiar with working with women's rights organisations and feminist organisations in our gender-based violence prevention and response work. It's really important, though, that we try to understand who these organisations include and maybe who they don't include. And it might be that in some cases, women and girls with disabilities are not actively participating in those groups. And in that situation, you may find that you want to outreach to and engage with some organisations of women with disabilities. And I know that our colleagues from Pakistan in particular, Dilshad is going to share a little bit more about that in Pakistan. The third action is to make GBV assessments and consultations disability inclusive. So we know that when we're planning a GBV program, it's quite common for us to go and to talk to communities about what's working, what's not working in terms of the current programming. And here, what we need to remember is because of the systematic exclusion that persons with disabilities face, we may want to actually try to reach some persons with disabilities and ask them for their experiences. This could be as simple as if you're running a group discussion in making sure that you include 1 to 2 persons with disabilities in age and gender appropriate group discussions in communities. So that's the planning phase, and those are the sort of top 3 actions that we describe in the tip sheet. Moving on now to the implementation phase, here we have 4 actions. The first one is to make GBV coordination and referral mechanisms more inclusive. In terms of GBV coordination, that could be engaging with some of those civil society organisations that we mentioned and involving them in the coordination groups that we have in place, particularly in humanitarian settings. And in terms of referral mechanisms, the main action here is to figure out what kinds of disability support services might be out there that a survivor might need to be linked to, in addition to the usual case management that we would provide for a survivor. So, for example, a survivor may require sign language interpretation. So if in our referral processes, we could make sure that we figured out where we can get a sign language interpreter that can be accessed throughout the case management process. Another example might be transportation. If you're not providing transportation for survivors to reach different services. You might want to reach out to disability service organisations that can support that piece of the program. The second action is to set standards on access and inclusion for GBV service providers. And this is where our disability inclusion and GBV assessment tool came from. So I will talk more about that in a moment in a bit more detail. We now have a tool that can be used with service providers to assess how they're performing in terms of inclusion and access, but most importantly, to plan what they might want to improve on. Integrating messages on GBV and disability into our advocacy and awareness raising is really important. And we are seeing that being done more and more, particularly around events like the 16 Days of Activism. We are now seeing that there will be programs raising awareness about the issue of disability and gender-based violence and how gender and disability intersect to increase the risk of violence faced by women and girls with disabilities. And then in most of our programs, we will do some form of training. Some kind of GBV training or curriculum development is very common in our GBV programs, even in humanitarian contexts. And here we can integrate content on disability into all of the standard trainings. We know that there is a lot of separate trainings being run sometimes on disability inclusion, but we would encourage you to start thinking about how you can integrate disability into the existing curriculums, because then they get repeated and it becomes part of our core business as GBV actors. Moving on to monitoring now, there are 3 actions here. The first one is to collect and analyse disability disaggregated data where appropriate, and it's important to stress that because it depends on the type of activity that you're running. So wherever you might be collecting, for example, sex and age, information about sex and age in terms of people participating in your program, think about also adding disability. But if, for example, you're running a hotline for GBV survivors and you find that you're not collecting any information sometimes in those cases for confidentiality reasons, then it would not be appropriate. But wherever you collect the usual beneficiary data, if you could add disability, that would be great. And we also have started to track the types of indicators that can be set on disability inclusive GBV programming and service provision. And in fact, in the tip sheet, we do provide an example of some indicators that were provided, that were set through the log frame development in Pakistan. And then lastly, we know we've got still a lot to learn about what works and what doesn't and why in terms of disability inclusion. And so we do recommend that wherever possible, you try to implement a sort of inclusive, a participatory action research cycle and integrate that into your program monitoring and evaluation. And that means putting organisations of persons with disabilities, preferably women with disabilities, at the centre of telling us what's working and why. And we provide some links to some resources on how to do that in the tip sheet. Moving on to the next slide, please. That would be great. I'm going to tell you a little bit more about the disability inclusion assessment tool. And so this is where I was referring to in the tip sheet, where we say, let's try to set some standards that we can monitor in terms of disability inclusion in service provision and GBV programs. So this tool that we've developed is designed for all essential service providers. So that's people delivering health, justice or policing or social support services such as case management to GBV survivors. And the objective of the assessment tool is to help service providers to assess whether they are meeting standards on access and inclusion for women and girls with disabilities, but more importantly, to identify the gaps and plan and track improvements over time. We want to stress that there's disability inclusion in GBV programming is very much a journey. It is not something that you can sort of do once and say it's done. And so ideally, we would like to see things such as this assessment tool integrated into just the routine monitoring and evaluation and quality assurance that we do with service providers and partners. Next slide, please. The way we've structured the assessment tool, which you can go and look at online, is that there are 25 questions or standards, and these are all in line with the common characteristics of the essential services package, as Sujata mentioned. So those characteristics are accessibility, availability, adaptability, appropriateness, and safety, which most of us will be familiar with. It also includes criteria relating to consent and confidentiality, communication and participation from stakeholders, data collection and information management, and of course, coordination and how we're linking with other sectors. Next slide, please. The guidance, the assessment tooling also includes guidance on how to answer each of the questions. For example, where to get the information that you might need to score or to rate that particular criteria. And the examples here might be, for example, consulting with women and girls with disabilities, or adding questions on disability to community consultations, conducting an accessibility audit, or reviewing the service provider policies, procedures, and training records to find out what is being actually done on disability inclusion. Throughout the process, we recommend engaging with organisations of persons with disabilities because it builds a bridge between them and the service providers, and it also helps us to plan together what's practical and realistic to implement. Sometimes there will be a lot of gaps, and so it's really important that we engage with organisations of persons with disabilities to figure out what gaps should we be addressing first. Next slide, please. So let's just have a very quick look at some of the questions in the standards or tools in the assessment tool. Next slide, please. This is just an example of what the accessibility standard looks like. The first sort of description of the criteria is drawn directly from the essential services package. So it's really important for me to stress here, these are not new standards. These are simply the essential service package standards that already exist applied to persons with disabilities. And you can see that there are 3 questions here. The first one is, has an accessibility audit been conducted? The second one is, has the service provider developed a plan to address the gaps? And then thirdly, is there any kind of provision for transportation for individuals to reach the service? The important thing about this, this particular criteria that I'd like to highlight is that we're not saying that every facility is going to, or every service is going to be 100% accessible straight away. What we're saying and what we're looking for is that we expect service providers and our partners to have a plan and to be monitoring that. And I think that's what's really unique about this tool. It's not just a, you know, it gives us the option to track progression and improvement over time. Next slide, please. On that note, I'm just going to share with you very briefly a little bit about this publication that you can access online as well. I will be handing over to my colleagues from Pakistan and Bangladesh to really share with you their promising practices. But as we've been developing these tools, we've been trying to also document what are our country office colleagues and the partners in countries doing in terms of disability inclusion. And that's what we have summarised in this publication. Next slide, please. And in the publication, what you'll find is a whole bunch of practical examples, practice examples from countries in the Asia-Pacific region that focus on 6 areas which we're calling promising practices. The first one is around adopting a twin track approach, which means that they might be mainstreaming disability into their existing GBV programming at the same time as thinking about targeted interventions. There are some examples of addressing negative attitudes, beliefs and norms which affect women and girls with disabilities and their access to GBV services. There are also some examples of setting standards and action planning with partners, which mainly comes from us from the use of that assessment tool that I just described earlier. We have a lot of examples in there of engaging with organisations of persons with disabilities, particularly organisations of women with disabilities. And I know that my colleagues on the call today will share a bit more about what that practically looked like in their countries. Through the Novel Data project, which Sujata has already mentioned, we do have some really interesting examples now of collecting and analysing disaggregated data by disability through the Violence Against Women surveys in particular. I think we've got a bit more work to do in looking at what it means for program planning, but the survey disaggregation is a great step forward. And then lastly, we do have some really interesting examples of capacity building GBV actors to be more inclusive through trainings and inclusive GBV curriculums. And I know that Jadul from Bangladesh is going to share a bit about what that looked like in Cox's Bazar. Next slide, please. On that note, I'm going to hand over to our colleague Dilshad from Pakistan, who's going to share with you all practically what some of these practices look like in Pakistan. Thanks, Dilshad. Over to you.
Thank you so much, Emma. Colleagues, good afternoon and good morning for those, it's still morning. Thank you so much for making it to the webinar, and really excited to share our experiences and learning from disability inclusive GBV programming here from Pakistan. As Emma and Sujata already shared, that we have this twin track approach to disability inclusive GBV programming. Disability inclusion is already is a part of our existing program. However, with the onset of COVID-19 here in Pakistan, we started off with a targeted standalone disability inclusive GBV programming here in Pakistan, in selected provinces, Punjab and KP, and here in ICT, which is capital, federal capital in Pakistan. And to implement the program, it was implemented in a way that there is OPD, Organization for Person with Disability, and jointly with government departments who are responsible for the provision of GBV services. And I'm just taking you to one of the initiative of the GBV programming, which is Disability Inclusion Accessibility Assessment for GBV services in KP, Punjab provinces of Pakistan, which is conducted in 2020, and we are finalizing the report now. Next. Okay. So just to give you a little bit of quick context, here in Pakistan, actually the number of persons with disability is really understated. We don't really have robust data even on the number of persons with disability. That was not clearly included even in the census. Only PDHS is producing some data which is telling us that 13% of household members aged 5 years or above have some level of disability in at least one functional domain. That's the data we do have. Usually we use that one. We know from the experience, from the practices, as well as from some data, that person with disabilities, they experience discrimination in accessing information services and opportunities, and often the laws, policies related to health, education, and other sectors and other services, including GBV and child marriage, they are usually silent on disability aspect, not really saying much on that. Thus, there is the resources we do have, the services we do have, they are either not really available for persons with disabilities or do not really have the capacity to serve persons with disability. However, to know this picture more in detail, we conducted disability inclusion accessibility assessment of GBV services in Pakistan in selected provinces. Next. Okay, so how we conducted this assessment? At first place, we used ESP, Essential Service Package, as a guiding document or guiding framework for this. So of all the services which are categorized as essential service for GBV survivors, we took those services and categorized them. And based on that, there was some selected chosen facilities or services which we were chosen to assess for accessibility assessment. To do this assessment, we used APRO's tool, which was developed for disability inclusion assessment. And here in Pakistan, we contextualized that tool and used to assess our GBV services. However, we added this physical accessibility angle to it as well. And key areas of the assessments were like physical accessibility. We just really wanted to see how these services, be it health, be it police station, GBV court, Darul Aman, which is shelter home and helplines, how they are accessible physically in terms of physical accessibility, accessible for GBV survivors. Second was also to look at their policies, guidelines, practices, SOPs, if they are accessible and if they are like talking to the needs of person with disabilities or not. This was one of our key area of assessment. And again, the third area was like to look at and assess their capacity, the training opportunities provided to them, or those mandatory kind of training opportunities, organizational capacity in general, whether it is like disability inclusive or not. And then also the referrals, the linkages and coordination that these services are doing, whether that's disability inclusive or not, we assess that one as well under the key area of assessment. And again, very important one, the communication with wider wider public and people who can be in need of it, people who are at risk of violence, and also their participation in designing, in improving that those services. We looked at these 4 or 5 categories for the assessment purposes. Since hospitals, police station, GBV courts, in Pakistan, we do have GBV courts, usually gender-based related issues, they go to GBV court for the justice. So we assess them in selected facilities, selected services in all these 3 territories and provinces. For these purposes, we conducted KIIs, focus group discussion, and the physical accessibility was conducted using a specific format for these purposes. While doing this initiative, we were very much aware of the ethical consideration and tried to ensure that ethical considerations are taken care of. The very first thing was permission from the department, because there are departments who are custodian of different GBV services. For example, health department being responsible and custodian of medical-legal related services and other health-related services, and social welfare being responsible for helplines and shelter homes, and also home department for police protection, prosecution, and justice. So we made sure that the permission is secured from these departments, and then the consent from those who are participating. We made sure that all the participation is voluntary. There is no pressure from anyone, either the department or the research group or the assessment group. So this was our key focus during the whole exercise. We made sure that during the assessment of the services, there is no interruption in services to GBV survivors. And also the privacy and confidentiality for service provision, be it the survivors or those who are providing services, made sure that their privacy and confidentiality is taken care of, and do no harm. During that whole process, we tried that we don't harm anyone during that whole process. And also, since it was to assess inclusiveness of the services, we designed the assessment team in a way that there were men, there were women, 50% of them, and there were also persons with disabilities to really be part of the exercise and provide inputs. And our partner, as I mentioned earlier as well, there were partners, there were stakeholders, broader stakeholders as well. So one organization for persons with disabilities, STEP, Special Talent Exchange Program, was our partner to conduct this initiative. They are certified to conduct accessibility assessment, physical accessibility assessment, and training was provided to them and their team on the disability inclusion assessment tool developed by UNFPA Regional Office. And Social Welfare Department, being the custodian of more than 3-4 GBV services, led the whole process together with National Commission on the Status of Women, and UNFPA was part of this whole exercise. And key services were included, as mentioned earlier, as well, hospital, police stations, and courts, and other shelter homes, helplines. Okay, next, please. So there are overall lesson learned and recommendation. Of course, there are lots of lesson learned and recommendations. Some of them are sectoral, specific to different services. However, given the paucity of time, I will share a few overall lesson learned and recommendation with colleagues. So one recommendation or one lesson learned actually is like always the intervention, disability, inclusive GBV programming especially has to be really comprehensive in nature. It has to take care of both of demand and supply side. For example, if we are creating awareness, providing information to persons with disabilities at the community level, and talking to them about their rights and the benefit of accessing gender-based violence and how to access them. If the services out there, they are not ready to respond to their needs, that's not a responsible intervention. That's what we have realized. So it's equally important to invest on the capacity, on the receptivity, and the sensitivity of organizations who are providing GBV services, and the service providers who are working there as social workforce and others. So that's our key learning from the whole exercise and from our overall GBV programming. Second is it's really important to incorporate disability lens in GBV related services related policies, SOPs for women and girls. Usually, if we look at the SOPs, guidelines, and other, related practices within shelter homes, hospitals, and other, they are not really disability friendly. They are not really inclusive for persons with disabilities and other vulnerable groups. So it's really important that all the policies and guidelines, they are revised in a way, reviewed in a way, and so that they are friendly and speaking to the needs of persons with disabilities. It's really important to improve physical accessibility of services. Sometimes the understanding is just by installing a ramp, the service is accessible to person with disabilities, but it goes beyond that. So it's really important to improve it in a true sense, and also broaden it a bit beyond assistive device or sometime ramp as well. So that's really, really important. Another key recommendation is develop a disability-friendly communication material. So a lot of communication material out there at the service level or overall on the social media, digital platforms, or provided in printed form, it's not friendly for person with disabilities. It's not available in easy to read format or other, sort of formats which are available or which are friendly for person with disability. So it's a little bit of more efforts, a little bit of more measures, but really important to make our communication material inclusive for person with disabilities by aiding sign language, by aiding different, measures, or by taking different efforts there. So that's our key learning. And we have, since this report is still in finalization process, we have validated the report is being finalized. However, we have started implementing or supporting government for the rollout of a few recommendations already. So for example, all the campaigns now we are developing, we are making sure that they are inclusive for persons with disabilities. And one key and important recommendation is involve persons with disabilities in the assessment and design of services. Usually when they are not part of the assessment, when they are not, they are not part of the designing different services, those services are not really then speaking to their needs. So it's really important that they are part of the picture, they are visible in the picture, and they can make or they can influence the decision made related to their needs, especially when it comes to GBV services. One key lesson learned is allocate human and financial resources for disability inclusion and responsiveness. Oftentimes, it's very much possible to make existing interventions disability inclusive, not by spending more. So if it's part of the design, it's very, very easy. Sometimes it's that, additional, or if not additional, dedicated human resource and financial resources are needed to make services inclusive and responsive to their needs. And I think it's really, really important. And we already have initiated this advocacy with finance department and other department who are doing resource allocation for the GBV services, so that the services are more and more inclusive to person with disability. With all these things, one thing which is really, really important, if that's missing, all of them will not be, so much effective and helpful. That is investment on the staff capacity and their sensitivity. So in terms of capacity, we have GBV case management. Here in Pakistan, we have made GBV case management curriculum inclusive for person with disability, and we also, include person with disability as trainers, as well as those who are providing services at department level. We prefer that they are trained on GBV case management and capacity building on laws related to disability here in Pakistan, because Pakistan have different provinces and this subject is provincial subject. So there are two provinces where there are disability laws, but other provinces do not have. So we try that wherever there are laws, there is required level of understanding of the laws, protocols, practices, and also international protocols and standards. However, it's equally important to invest on their sensitivity towards this. It's important to have that kind of discussion, discourse analysis, value-based discussion with service providers and other related stakeholders, including person with disabilities, platforms, and others, so that there is required level of sensitivity towards person with disability, because GBV itself is a multi-sectoral issue, and the response should also be multi-sectoral and comprehensive. One thing which is very important, and Emma Sujata earlier mentioned it, that's improve coordination among essential services for the survivor of gender-based violence, especially those who are with disabilities. So usually these coordination mechanisms are missing in a lot of settings, but where there are coordination mechanisms, usually they are not really, really inclusive to the needs of person with disabilities. They are usually, absent from that bigger policy making picture, bigger overall data that we collect. So it's really important that through coordination mechanism, special measures are taken so that, person with disabilities, they are included, they are taken care of through in a coordinated manner. One, not of course, last one, because we have other recommendations as well. And when the report is finalized, we will share the report with colleagues. But very key kind of recommendation is like, it's important to explore partnerships with OPDs. It's really important to enter into partnership with Organization for Persons with Disabilities. This provides opportunity to engage with different networks and platforms where persons with disabilities are present. They are having those discussions. It's really important to reach out to them. Secondly, it's really empowering to bring them to this equation so that they are part of it. They are part of the assessments, design. They are influencing design, because it's at the end of the day belong to them. So it's really important lesson learned from our initiative here in Pakistan. And this initiative, the overall GBV initiative, is also documented as a promising practice that's available in the document which Emma has already shared. With that, I will say thank you to all of you, and over to you, Jahida.
Thank you. Thank you, Dilshad. My name is Jahidul Islam. I'm working as a disability coordinator at UNFPA Bangladesh. I will be presenting about a training that we conducted for GBV case managers for disability inclusion, a pilot action from Bangladesh. Next slide, please. The main purpose of this training on disability inclusive GBV programming and response was to enhance the knowledge of GBV response staff on disability inclusive GBV case management, and to make them more conscious about confident in supporting survivors with disabilities. The training took place in Rohingya refugees and adjacent host communities in Cox's Bazar district in Bangladesh. The training was the first of its kind in the area. The participants of the training have been working for women and girls in safe space and safe corners located in refugees camp and in health facilities run by two implementing partners, ActionAid and BRAC. A brief context of the training. Cox's Bazar is hosting nearly 1 million refugees along with the 500,000 of host population in the adjacent area. This place has a number of challenges, such as lack of access to water and sanitation, violence against women, and people with disabilities having very limited access to basic services. Next slide, please. The comprehensive training is undertaken to build the capacity of GBV facility staff and others involved in GBV case management to effectively manage GBV cases involving women and girls with disabilities, and to increase their knowledge of disability inclusion. The training takes 3 days and has covered the following topics, like an overview of disability, especially in Bangladesh context, the Washington Group short set questions on disability. There are 6 questions which help to identify disabilities, how to use the disability accessibility tool developed by UNFPA Asia Pacific Regional Office. Earlier today, Ima had already talked about this tool in her presentation. There was also a topic on GBV case management for women and girls with disabilities. Basic communication techniques with survivors with disabilities, disability consideration in implementing a survivor-centered approach, guidelines for service providers and support staff working with survivors and young persons with disabilities. Information on what services are available for survivors with disabilities regarding GBV. The training also included the development of a disability inclusion action plan by the implementing partners, where after attending the training, where they find out there some of the lacks so that they can be work on that after the training. Next slide, please. The learning from this training was very important for me because being myself as a person with disability, I'm a wheelchair user, by the way, and I co-facilitate the training along with other colleagues. My involvement in this training has sometimes helped the participants to understand the difficulties that some people with disabilities may face. I have also learned about the GBV issues that women with disabilities may face. The training has led to improve accessibility of GBV response facilities and services for women and girls with disabilities. GBV service providers are now better equipped to identify and address infrastructural and communication barriers, ensuring that facilities are accessible and inclusive. In Uki Upazila, BRAC, one of implementing partner, has developed accessibility infrastructure in their WFS, and they are continuing to further improve accessibility. The training has increased the utilization of GBV response services by survivors with disabilities. Service providers have gained knowledge and skills to provide appropriate support and accommodations, creating a more welcoming and inclusive environment for survivors with disabilities to seek help. So far after training, 311 women with disabilities have accessed WFS. The training has enhanced the quality of care provided to survivors with disabilities. Service providers have learned about the specific needs and vulnerabilities of women with disabilities, enabling them to deliver tailored and sensitive support. For instance, at WLCC in CAM, one wheelchair is available now to provide support for women with physical disabilities, which was not available earlier. So this is about the training that we have conducted. Thank you. I would like to over now.
Thank you. Thank you so much, Jadul and Dilshad. Next slide, please. Look, we are going to stop and have a bit of a discussion and an interaction, but before we move into that, I just wanted to share with you some of our reflections on the ongoing gaps and opportunities for strengthening disability inclusion in GBV programming. One of the things we learned over the course of these last few years in developing these tools is that we really do have to not only develop tools and resources, but support their implementation. And sometimes that requires a lot, you know, it's going to take more than just delivering these tools to people. We need to be raising awareness about them, and then thinking about the mentoring and, I guess, reflective practice process that might need to accompany them. So that's a gap, but also an opportunity, perhaps something we could collaborate on more together in the future. We also noted that, you know, of course, there are a lot of assessments happening, and it's really important for that to be translated into action, which is why in our assessment tool, you will see an action plan that accompanies it. And we really do see this assessment tool as being something that can and should be integrated into the more ongoing quality assurance mechanisms that are put in place in your GBV programs, whatever they may look like. We also note that whilst we might have examples now of adaptations being made to programs, and you'll see those in the Promising Practices document, we're still lacking in evidence on what works and why. So we're not completely clear yet on what the impact is of some of these initiatives. How does it change the quality of care delivered to survivors with disabilities? And so that's something that we want to be able to measure more in the future. And we really want, as I said before, for us to focus a bit more on the mainstreaming of disability into GBV service provision. As I said before, you know, a lot of these tools can be integrated into already existing processes that happen in a GBV program, that happen in a GBV service. And I think that that's what will take it from being perhaps pilot projects, pilot initiatives, to being part of our core business, part of what we do every day in our GBV programs. And we know that there's already a lot of stuff that our particularly frontline workers are already doing, right? They often are supporting persons with disabilities. And so being able to integrate it more into the day-to-day workings of our programs means we can support them better and learn from them as well, what's working and what's not. On this slide, I have a cartoon, which I share in a lot of the sessions I do, and it's from CBM's Disability Inclusive Development Toolkit. And there are two women. One is in a wheelchair, and they have a cup of tea, or maybe coffee, I don't know. And the woman who's giving the woman in the wheelchair a cup of tea says, "So, do we call you differently abled, physically challenged, or wheelchair bound?" And the woman in the wheelchair says, "How about Fiona?" And I think that that's a really great example of how we need to not get too complicated too quickly. Let's start with the really simple things, and let's start by just asking women and girls with disabilities what they need us to do. Next slide, please. And following from that, I wanted to share with you a quote that we got from a student with disabilities club that was working with our Vietnam office. When I was speaking to this group, they shared with me this piece of feedback, and they said, "We are not just beneficiaries, but also agents of change. I hope that in the future, in future activities by UNFPA and other UN agencies, I hope that you will find space for us. We can join and contribute." And I think that again, keeping it simple, that's something we can do right now. That's not super complicated. That's something we can do, creating space and inviting people to join us, inviting persons with disabilities to join our work. And so I guess I just wanted to close with that kind of reflection, because I know there's a lot, it can feel like there's a lot of gaps sometimes, but people are telling us, people with disabilities are telling us what we need to do. And some of these strategies are very simple, creating space, making them feel welcome. But I'll hand over to Sujata, because I'm sure there's a lot more for us to discuss today. I'm really looking forward also to hearing some of your experiences as well. Thanks, Sujata.
Thanks, Emma, and thank you, Dilshad and Jaidul. If you were in person, I would really request everyone to give a big round of applause, but perhaps we can use the reaction button to do so. So colleagues, we have the next 30 minutes to have a bit of a conversation around this. And as we mentioned earlier, we really wanted to use this time to build on the learnings and really share with this amazing platform that we have, the community of practice, to better understand how do we take this forward. So we have a few questions here for our for our conversation, but I also see that there are a few questions already in the chat. So maybe we'll start with that. There's a question from Joseph about asking about the trainings and whether they have led to improved accessibility of GBV response facilities, or has it led to knowledge in this area? So maybe I'll turn to Jaidul and Dilshad to reflect on the programming that you discussed in your pilot on this particular question. Jaidul, I see that you have unmuted. Did you want to come in? Yes, please go ahead.
Yeah. Thanks for this question. Yes, the training has led to improve the accessibility of the GBV facilities, because as I mentioned in my presentation, and before attending the training, the participant has a very minimum knowledge on the disability inclusion, and they found that attending this training was very much effective to more effectively provide services to the women with disabilities. So after attending that, they are now aware about the issues that they face, and about the accessibility, about services and communications. So we have also get to inform that the participant, the implementing partners, some of the facility space, they have improved the accessibility, like they have newly developed the ramp and providing assistive devices. So these are the outcomes of the after this training.
Thank you, Jahed. Dilshad, did you want to come in, if you can unmute?
Yeah, thank you so much, Sujata. Yeah, there are some improvement in the accessibility of GBV services to persons with disabilities through these trainings and capacity building we have done. For example, the helplines, they have included in their, they're responding to persons with disabilities in different way, and also included in their data tracking sheet, data collection sheet. So they're collecting more and more data administrative data for person with disabilities. However, I just would like to mention here that the accessibility, this assessment itself is of course not changing anything. We have developed a tracker on the basis of the recommendation of studies, and departments, they have to, a lot of them, the government has to implement, and we will be advocating. So we just see that in few years, coming years, there will be more and more changes. We see a lot of challenges. Sometimes those challenges are even more, severe, serious. For example, their access to shelter homes. So they are not now really ready to respond to person with disabilities, different types. So however, helpline, health, and police protection and other are, as compared to the shelters, bit easier. However, we have seen some improvement, and it's in process.
Thank you, Dilshad. I also see our partner in Pakistan, Abia Akram, online. I just wanted to check if, Abia, you want to add any reflections on this. So sorry to put you on the spot, but please feel free to jump in if you have any reflections.
Yeah, thank you so much, Sujata. Thank you, everyone. And thank you, Dilshad, for giving a comprehensive presentation about the work we have been doing collectively in staff and UNFPA. That's really the pilot, but we are learning from each other. And it's actually giving a very huge opportunity for women and girls with disabilities to technically contribute, because previously we were working the advocacy work that was not addressed to the stakeholders, to the policy makers, and the systematic changes were not happening. So this time when we work in a collaboration, targeting with these assessments and a proper way of consultations with the existing services, that is creating a huge change. And we know, like, now the organizations of persons with disabilities are engaged, the UN is there, the state representatives are there, and using these tools are making really like inclusive approach to the helplines, to the GBV code, shelter, all those services. We know still persons with disabilities, especially women with disabilities, are facing the challenges, because we are creating the demand to talk about the GBV first time in the history, and at the same time we are finding it difficult to respond. So these twin track approach and the interlinked approach is taking some time, but I think it's an ongoing process, and with the support of the partner, especially with the UNFPA, it's creating an impact. And we really hope that this will create a long-term plan which is sustainable, and we can see that women with disabilities get access to the justice, to the services, and it's all because of their engagements and their involvement from the top to the bottom, and engaged as our survivors with disabilities to talk about their experiences, and at the same time they are highlighting the gaps and the challenges. So I think this will have a very long way to go together, but these tools and the experiences and the international commitments are really important to address. Thank you.
Thank you, Abia. And hearing that from you is huge encouragement for us. So thank you for jumping in to share those insights. I want to maybe turn our attention to some questions that we received from Liat. Liat, I don't know if you want to just take the floor and share your questions.
Hi, Sujata. I don't know if you can hear, I have music in the background, so I hope you can hear me okay.
I can hear you, go ahead.
Okay, thank you. Just noting that women and girls with disability is not just a one category. I was just wondering if the excellent tools, thank you so much for presenting and for sharing them, do they have any, way to really assess and address the needs of various forms of disability? And I think I mentioned some of them in my message, which is physical, psychosocial, intellectual, sensory conditions. How can we do better to address different forms of disabilities? And yes, I know we still need to keep things simple. So this can, also be a challenge sometimes, but it's just wondering. And then also noting that there's other intersecting identities and vulnerabilities. For example, some women with disabilities also face, or ethnic minorities, or refugees, or women migrant workers. So how can we address their specific needs? Thank you.
Brilliant questions, Leah. Thanks for that. Could I ask you, Emma, to jump in with a response to this? Thank you.
Yeah, sure. Thanks so much for that question. So yes, in terms of the tools, we have made explicit reference to particularly communication and looking at different forms of communication, and made references to things like, for example, easy to read formats for people that might have intellectual disabilities, so that we're making sure that we're sharing information on GBV with everyone and we're not missing a group. I think the really important thing to stress here is that there's no recipe as such, that will work for everyone. And so what we really need to think about in particularly our information sharing and our communication skills is having a variety of skills, a toolbox, so to speak, and making sure that when we're sharing information about the availability of services, that we do that in multiple formats and don't just rely on one way. And I would say that one of the really important ways of sharing information, particularly with women and girls with, say, intellectual disabilities or psychosocial disabilities, is actually through peer networks. It's actually through the people they already know and they already trust. And again, I think Pakistan has, thanks to STEP and the UNFPA Country Office there's been some really interesting work on that, of sharing information about the availability of services through the Women with Disabilities Network. So you will see some references to those things in the tools. The other area that I would say is a really good entry point for diversity in terms of different types of impairments, different situations, is through the training packages that we're delivering on GBV. So we have done a bit of work looking at integrating disability into existing GBV curriculums and training packages. And I would just encourage everyone to go and have a look at what you're using, because it can be as simple as just a slight adaptation to a case study, which all of a sudden creates an element of diversity that maybe our GBV colleagues haven't thought about. So a classic example here is, for example, if you've got a case study of a woman needing to use a safe house or a shelter, and she's got to take her children with them. Well, what if one of those children was actually an adult male with an intellectual disability that she's caring for and has to find safety and protection for her whole family, for all of her children? That is just creates a level of diversity that can be really interesting to explore in a sort of case study kind of scenario setting activity in training packages. And then the last thing I wanted to say on the intersecting identities component is I would just encourage you, because I know on the call we have a lot of people in the humanitarian sector. I used to work for the Women's Refugee Commission many years ago, quite a few years ago, and we developed a whole bunch of tools and resources on disability inclusion in GBV programming for refugee settings, including conducting a pilot project with the International Rescue Committee, where we captured a lot of really interesting stories of change from refugee women and girls. So I'll put the link in the chat box, and we can, but I'm sure many of you will have seen those in the past, but they're really interesting tools for those of you that are working in refugee contexts. Yeah, I'll stop there, Sujata.
Thanks, Emma. Dilshad, I saw that you unmuted earlier. Did you want to also contribute to this question?
Yeah, thank you so much. I think Emma has responded to this really well. However, just quick addition I would like to make here. This is one thing which we realized during our work with government on GBV and disability inclusion, that the understanding is really, really limited. We really, like, the service provider, they go beyond a few types of disabilities. So you're very right. It's really, really important. So we have initiated this capacity building of those people who are responding and those people who are responsible for policy making and resource allocation on the types of disabilities. We are more and more in discussion with them. That's one thing which we are doing. It's very initial stage, but we have started that journey already. That's one thing. Second is, you're very right, intersectionalities. For example, in a context like Pakistan, which is very diverse. So there are lots of intersectionalities. For example, a person with disabilities, women and girls with disabilities, then ethnic minorities, religious minorities, refugees, flood affected or internally displaced people, a lot of others, rural poor, urban poor. And then to some extent, the person with disabilities, women and girls disabilities coming from well-to-do families, they're also vulnerable to different types of violences because of their overall, right to inheritance or access to inheritance. We yet to know that. We are like now planning to conduct one study, knowing the intersectionality of it. Hopefully in due time, we will be able to share that story with you as well. Thank you.
Thanks, Dilshad. Thanks. I'm aware there are quite a few questions coming in, so I'm trying to see if we can manage to combine them and answer them. But also hear from you, colleagues, because I'm sure there's a wealth of knowledge and information among us, and would love to hear from you as well. We have a question from Tilina about how do you identify disabilities, and she's talking about hidden disabilities. Tilina, if you want to take the floor to share a bit about your question, please do so. If not, in the interest of time, Emma, do you want to come in because we can all read the question?
Sure, thank you. And I might invite Jardul as well to help me out with this one. But the question here is about identifying persons with disabilities, because oftentimes persons with disabilities, because of the stigma they're experiencing, may not feel comfortable disclosing that they have a disability. And so Jardul mentioned that they're using the Washington Group questions in Bangladesh, which is a question set that has been designed to help identify if someone does or doesn't have a disability. And it's built around questions relating to difficulties in functioning, which of course links also to the World Health Organization's conceptualizations of disability. Now, as with any kind of measurement tool, there's pros and there's cons. So the Washington Group questions have been tested, and they have been shown to be reliable in quite a few different countries, but they don't necessarily capture everyone, particularly people with psychosocial disabilities. They often get missed through that tool. However, the World Health Organization does have a range of other tools that have been developed, which of course are a little bit more complex, a little bit longer question sets. And they may not always, the length of them may mean that they're not always appropriate to be asking in, for example, a case management setting or a hotline setting in a humanitarian context. We recognize that, when we're interacting with survivors of violence, we need to be very careful about the questions we're asking and make sure that those questions really are relevant to their needs and to their priorities. But Jardul, I don't know if you want to share anything about your reflections on using the Washington Group in
Yes.
Bangladesh.
Yes. Thank you, Ima. You correctly mentioned and you correctly answered to this question. Just to addition to you, along with these Washington short set questions, we also discuss about the 12 types of disabilities that identified by the Bangladesh government and mentioned in our Disability Act 2013. So in our training, what we did, like with the picture and the communication and symbol, we try to make participant understand about these 12 categories, types of disabilities. And also, as you mentioned, that the Washington short set questions, the 6 questions, which help to identify the questions. So yes, thank you.
Thank you, colleagues. I see there are 2 questions which are a little bit similar, so I'm going to make the attempt to combine them. We have questions from Kami and Julia about the engagement with CSOs and CBO actors who are already working on disability inclusion and advocacy. And from Kami, she's also asking about the process, the methodology and tools, whether they have increased or improved collaboration, including with the OPTs, and how we are measuring that. I mean, these are a lot of food for thought, but I do think if some of us who've been working on this could reflect on it. I don't know, Emma, do you want to give it a start, and then we'll turn to Dilshad and Rahidul?
Yeah, I mean, I think measuring how we measure collaboration and participation, this obviously has pretty strong linkages with like localization agendas, right? And also our feminist approaches that we're increasingly adopting in a lot of contexts. And I think that is a real area for future collaboration, for future work that we need to do together. I would really be interested also to explore, at some point in time, how in fact, we're building inclusive women's rights movements, inclusive feminist movements relating to that advocate on, prevention of violence against women, because it's not just about working with DPOs. It's also about us making that wider women's rights movement more inclusive and building bridges between the two. So that's what I would be really keen to measure more of in the future. But that is a work in progress without a doubt, and hopefully we can collaborate together. Maybe there are some experiences though from Bangladesh and Pakistan.
Yeah, thank you so much. So yeah, we have experience of engaging with CBOs and CSOs. For example, this Organization for Persons with Disabilities STEP, which is our implementing partner as well. So it's a CSO, it's a national organization. That's one thing. And then through that, we engaged with further CBOs and CSOs and different networks, which are there at provincial level, at grassroots level. So we very actively engaged during COVID-19 through digital platforms, online platforms. Later on, it was also in person. So going to them and bringing CSOs who are working on disability inclusion, or for person with disabilities, by person with disabilities, in discussion with government, so that that dialogue happens. Both of them, they are on the same platform, government responding to them, listening to the needs, and that sort of platforms we have created. That's one thing. And for collaboration bit, I think it's when you bring Organization for Persons with Disabilities and create that environment where they are sitting with government, there is increased collaboration. We have a few things to claim. For example, now persons with disabilities are a bit more visible. If you look at technical working groups or different bodies formed at National Assembly level or parliamentary even bodies level, you will see more and more. For example, Parliament here in Pakistan conducted accessibility assessment of its buildings. So such kind of things are happening because of the collaboration of persons with disabilities with high-level institutions such as Parliament, such as other parliamentary bodies, policy-making bodies, and government departments and entities who are really can influence the decision making. So that's happening. Coming to the measurement of it, I think that's a tricky thing right now. That's really a tricky thing, how to do it. Even measurement from a very low level up to the level where collaborations are happening and how they are resulting in it, that we still have to do. And I think, we have initiated this whole process. It's been more than 3-4 years now. So we yet to wait and see and develop such mechanisms to see and measure.
Absolutely. Thank you. And I think it's also, as you mentioned, to really do meaningful measurement, right? And not tokenistic is going to be the challenge for all of us. I wanted to, as we move to the other questions that we're seeing in the chat, and thank you, colleagues, for taking such active participation in this. If I could turn to, I hope I'm pronouncing this right, Marie Ang, the resources that you have shared here. We'd love to hear a little bit about the research on barriers faced by women with disabilities in accessing health services that you have shared. Thank you for sharing the resource. I don't know if you want to take the floor. We'd love to hear a little bit about the work that you've mentioned in the chat.
Thank you so much, everyone, and thank you for giving me the floor. Yes, I could not resist just to share a few of the resources we have been developed. As you know, so I work for Humanity and Inclusion, previously known as Handicap International, and this is really our work we have been conducting in regard to inclusive sexual and reproductive health rights. So we started 4 years ago. Now it's time we are doing like the lesson learned, and we have managed to develop all the what we call the global goods and the guidelines we wanted to do for this program. So kindly, yes, you can have a look, especially that this program, which is the Women Integrated Sexual Health as a WISH, was implemented both in Africa and in Asia. And when mentioning Asia, it was mostly Pakistan and Bangladesh, plus we were doing some support work in Afghanistan. So we could have like this kind of global figures. So I could thanks so much for the work you have been doing within UNFPA, but I could really recognize the same effort all the way from questioning which kind of data collection to conduct, how to include the OPDs at each steps of our intervention. So yes, in regards to this barrier assessment, it's a qualitative effort. So we conducted both in Bangladesh and in Uganda, where I'm currently based. And it was like really like a very strong pillar for developing our activity afterwards. And that's where we could identify, we all know that the physical barrier is the first one that appears when discussing with people, but actually it's really like the last barriers. If people cannot even within their community being visible, it's not about a ramp will not change everything. So that was very interesting to hear the voice of the people. So we conducted a series of focus group discussion and key interviews with persons with disability, with OPDs, and with service provider. And we kind of differentiate all the barriers in regards within the community, but also within the health center. So yes, one thing, whether you are working for sexual and reproductive health or GBV more specifically, one thing that is very important to, and I'm kind of voicing the voice of people with disability I heard since 4 years, it's really like, the first point is to consider that very often persons with disability are considered not to have a sexual life. So then all services in regards to GBV or SRHR are considered not to be useful for them. And even, thank you, Dilshad, to mention about the Darul Amans. I worked for 3 years for Darul Amans, so it's very close to my heart. In regards to Darul Amans, the same. I'm sure in Pakistan, people consider that person with disability, they are lucky even if they got married. So why will they even be any news of a center as a Darul Aman? You know, so it's really like to deconstruct from the beginning all the social norms, the myth and misconception within the community, but even within your service provision center. Like, what is the perception of disability? Are persons with disability like allowed to have a sexual life? Are they allowed to have like sexual education to understand what is happening with in their body and so on? So sorry, I can speak for hours, but I'm very, very happy to be in this community today. And please, if you have any specific question, please ask me in the chat, or I can share my email address. And if you feel like it, have a look to the resources I share. Thank you so much.
Perfect. Thank you. That's great contribution to us. And that was what we were hoping in doing this webinar, is to really learn and build upon all our collective efforts. I'm conscious of time, colleagues, and I know that you have put other things aside during these 16 days hectic time to be part of this. So really want to be mindful of that. Before we close, I just want to turn to our panelists, particularly Dilshad and Jahidul, to have maybe one last reflection. If you were to do this all over again, what would you do differently? Maybe we start with you, Jahidul.
Yeah, thank you, Sujata. Thank you. Yes, as I mentioned, that this was our pilot program and the first of its kind training. So, it was mostly a lot of learning for us. So if we would get the opportunity to organize this kind of training again, we will be definitely like more ensuring the OPD's participation, women with disabilities, more participant. So so we can hear from them as well, and so they can share the more experiences, more information. So these things come in my mind that could be.
Thank you so much. Dilshad, any final reflections?
Thank you, Sujata. So for me, we tried to do this way previously as well. That didn't work at that point in time because government was not really ready to drive this and lead. They led this process not to drive their whole accessibility assessment at that point in time. So that's why STEP and UNFPA, we did the technical work under the leadership of government. If I have to do it again, I would prefer to build government focal persons' capacity on this tool initially, and let them, lead technically this whole process. Because now what we are doing is like we are developing a tracking sheet of recommendations and providing to government departments and then doing follow-up with them. This is what we are doing. But for other provinces now, the plan is we will not do like that. We will ask government to lead this, do it, technically be there, involved there, so that whatever, tracking sheet, whatever recommendation they develop, it will be their own. And, wherever we are relevant and we can provide that support, we will be there to support. So that's one thing. And second is like, I think it's really important to understand and act accordingly, that it will not happen on its own. That continuous efforts from our end is needed. It might take some time for GBV service providers to make it part of their intervention. However, our support shouldn't be similar all the time. We can't really expect similar thing by doing same thing. So it has to grow in nature. I think that's really important thing we have to do going forward.
Thank you, Dilshad, for that call to action. Emma, any final words?
Yeah, just something that I thought of in response to Late's question earlier that I wanted to share is please also remember that when working with women and girls with disabilities, particularly those with intellectual disabilities, they'll often be presenting to services with a protective family member, someone like a mother or a sister or a cousin who they trust. They often don't come alone. A lot of survivors don't come alone to services. They come with support people. And we really do need to pay attention to the needs of those support people as well, because they've all had, experiences of violence, and in particular caregivers, how to safely engage caregivers when we're providing support to survivors with disabilities is a really important piece. We need to think about their needs as well, while still keeping a survivor-centered approach. And there are guidelines and some tools out there that can help you with that, particularly in that Women's Refugee Commission IRC toolkit that I've shared online. So please have a look at that. And then the last point I just wanted to make was coming back to our sort of, making disability inclusion part of our core business, and by mainstreaming these guidelines, these tools, these resources into what we're already doing, what we're already implementing. I think what's really important here is to not see these tools as something separate or different. So whilst we have developed this assessment tool to be aligned with the essential services package, there's absolutely no reason why it wouldn't be aligned also with your minimum standards in emergencies. And rather than just saying, having one criteria which usually says something like, are we reaching everyone? We really need to start asking a few more questions, adding a bit more content into those assessments and quality assurance processes to really understand who are we reaching, who are we not reaching, and why. Sometimes it's going to be individuals with disabilities, but as we've been talking about a lot today, there's a lot of intersecting factors there. No one is ever just one identity, and so we need to really start adding texture to how we understand who we're reaching and who we're not reaching. I think I'll stop there. Thanks, Sujata.
Thank you, Emma, for those wise reminders for all of us. And thank you to the GBV AOR COP, the Community of Practice, for giving us this platform to really have this discussion. We have learned a lot, and we've also been able to share a bit, and that already feels really good in terms of having this community that's listening and understanding and also building upon this. I've just projected here our email addresses, colleagues, both Emma's and mine, and we also have Dilshad and Jaido, who, if you can kindly put your email addresses if you feel comfortable in the chat. Please reach out to us. Please, let's build on this. We need all hands on deck to really take this agenda forward. The GBV's AOR COP will share the recording and the resources, as mentioned in the chat. But please reach out for any kind of collaboration and discussion to take this forward. Over to you, Sarah, for the final closing.
Thanks, Sujata. Thanks, Emma. Thanks, everyone, all in our amazing evaluation and participation by all of you. Thanks for filling out our evaluation form. We want to make sure that we provide all of you with the content that you need to do your really valuable work on gender-based violence and emergencies. And I'm so happy that we had some time during these 16 days of action to focus on working with women and girls with disability and looking at their needs and how we can improve our GBV response to them. So thank you all for taking the time to join us today. And we'll leave the poll open for a few more minutes, but we'll just say goodbye. If everyone could turn on their cameras and say goodbye so we could see some faces, that'd be great. Thank you all.